Today is part one of a three-part series about cochlear implants and what that means for you. Hey everybody, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about anything and everything audiology.
Yep, and if you're not sure what audiology is, make sure to like and subscribe to our channel. Hit the little bell notifications button to keep up with all of our great content, and we will tell you all about it.
Hi everybody, welcome to our, So we thought we would break it down for you. Into a three-part series, sorry. All right, so today we are going to talk about cochlear implants. We have been talking about different topics to cover, and patients ask us all the time, what are cochlear implants? Am I a candidate for them? What do they do? What's the process in all of this? And so we thought we would cover that in a series and just kind of break that down individually as to what they are. And today that's what we're going to discuss, is what are cochlear implants and how are they different than traditional hearing aids?
When we're talking about cochlear implants, I think a lot of patients have the misconception that it's an implantable hearing aid that gets put in and then everything just goes back to normal. It's like a replacement for the auditory system, and that's just simply not the case. A cochlear implant is meant for people who are no longer receiving benefit from their hearing aids. So either the hearing loss has gotten so bad or their ability to understand speech has gotten poor enough that traditional amplification with hearing aids is just not cutting it for them anymore. So I think in this context, it's really important to understand, first and foremost, the differences between those devices. A traditional hearing aid just takes sound, processes that, and makes it easier for the brain to understand, and then puts it back into the ear. So essentially we're using the system that's there, we're just kind of augmenting the sound before it gets into the system.
Right, and with the hearing aid, like Michael said, you're going all the way through that system, the entire way through your auditory system. And with a cochlear implant, we can kind of, I guess, bypass some of that, and we're converting the signal, or the cochlear implant is converting the signal just into a different form of energy to be able to stimulate your cochlea so you can hear in a different way.
Right, there's an internal and an external component. So the external component is very similar still to what a hearing aid looks and acts like. The difference is, instead of changing that signal, like Carly said, from an acoustic signal into an acoustic signal, it's acoustic signal into an electrical signal. The internal portion is what delivers that electrical signal to the organ that's responsible for hearing. It basically stimulates the nerve fibers directly so that the brain can then interpret that as a hearing signal instead of the traditional mode of hearing.
Yeah, and I think it's important to kind of go back to what you said about patients asking, because I get asked this all the time, is, okay, well, when I get a cochlear implant, does that mean I can hear normally again? And unfortunately, the answer is no. There's not a device or a surgery at this point in time that can completely restore your normal hearing. If you are a candidate for cochlear implants, which we will discuss in the next episode, I'm assuming, we'll go through the candidacy process and what that looks like. But if it is an appropriate option for you, what we hope to find is that a cochlear implant may be able to give you more potential, a higher potential to hear better, but we're not able to restore that normal hearing. And then the other part of it is there is quite the adjustment process to that, because you, as Michael just explained, you're just hearing in a completely different way, and we have to retrain your brain to be able to use that information appropriately.
So now that we have a better idea of the differences between like a traditional hearing aid and a cochlear implant, I think it kind of lends itself well to talking about what the motivation would be, or why somebody would pick up the phone and call about testing to see if they'd be a candidate.
I think most commonly we see people call because they are under the impression that they're not hearing as well as they'd like to with their hearing aids, or their hearing aids aren't working to the best of their ability and they feel like they want to look into a different option. And so a lot of people will think, well, maybe a cochlear implant would be right for me since these hearing aids that I have are not doing the job. We also do have people calling in that have never worn hearing aids before but have read about cochlear implants or heard about them and just think that maybe that might be a good option for them instead of hearing aids. And then we do have patients that we do monitor over time, knowing that they may eventually get into the point where they are a candidate for cochlear implants because of a progressive hearing loss, something like that, that we're watching kind of closely as they go through that journey with their hearing loss.
Right. And you've heard us say the word candidate or candidacy quite a bit throughout this episode. Candidacy is a really, really important component to the cochlear implant pathway or journey. And then on the next episode, we're going to take some time to go through that candidacy process as an overview and kind of give you all an idea of what that looks like, so that if it is something that you're curious about, you have kind of an idea of what to expect.
Okay, so to sum things up, today we talked about what the differences between hearing aids and cochlear implants are, and we kind of touched on why somebody may feel that they want to look into getting a cochlear implant or learning more about a cochlear implant. And then next time we're going to dive into what the candidacy journey looks like, and kind of break that down for you there. If you have questions, please reach out and let us know. You can email us at info@hearwv.com. You can leave us a comment. You can call our office at 304-428-2403.
And don't forget to like and subscribe to our YouTube channel. If you liked what you saw or heard, we really appreciate it. And until next time,
Thanks.
see you later.